youth. So to start, we're going to start with our objectives. We're going to enhance your understanding of how race and racism manifest in the Black male mental health, to create hostile environments for treatment. We're also going to give you some strategies for creating racial equity in your environments, whether it's education or whether it's the medical setting. And with these direct practices, it'll be meaningful approaches that support the direct engagement for African American male youth, and to undo racial practices of care. To do so, we want to set the stage. We're going to provide a historical analysis of how race, racism, and privilege has affected our Black males in the medical setting and in the larger societal settings. You're going to get a short theoretical background. Promise I'm not going to theorize you to death of what cultural script is, what it means to us, how we operate in it, and then provide you the direct application for action to get Black male youth into our services. So the key term today that you're going to learn is cultural script, and I'll provide a working definition for you for that. While we're in this meeting, we're going to have some community agreements in this webinar. I want you all to be as present as possible. I know sometimes things may happen in your background. You may want to answer a question, which is very, very fine, or you may have a question. I just want you to please be present. I want you to create space for multiple truths. We're going to be talking about some experiences and some historical context that may be very sensitive to some folks' ears, but we want you to create that multiple truths in this space. There's no such thing as a safe space if it is not occupied by cultural insensitivity, which means if you don't have an understanding for different demographics, or you don't have a cultural awareness of what's happening in a large society, there can never be a safe space for folks to express how they feel or to share their experiences. We also want you to center this webinar for learning and growth. There should be no shame, blame, or guilt in anything that we do in this webinar. This is all centered for you to have an understanding of how to work with Black males in the medical setting and in the educational setting. So to start with, why are we here? Well, since 1619, African American identified bodies have been in pain from public consumption, from public rapes, from whippings to auction blocks to lynching and some forms of police brutality. African Americans not only been victims of racist violence, but in some way or another, they have been forged into this traumatized collective historical memory of sites of conflict. This has also been amplified in 2020, post-COVID and pre-COVID, with the combination of the pandemic and the racial reckoning alongside with inundated images of Black bodies that has reinforced trauma into the minds of our youth, so much that it's normalized in their bodies to where they feel numb to situations. This is no new phenomenon. Since enslavement, the creation of the Black body has been used as a dehumanized tool and objectified only for its physical use of labor and exploitation of sexual exploitation. How does this affect our youth? Well, because of this exploitation and these experiences, our African American youth see themselves as gladiators, only for the enjoyment of white elitists to profit off of or continue the historical enslavement of Black bodies. These ideas and narratives have been embedded into our African American youth so much that it's a tool utilized for liberation from racist acts and practices. So when a gladiator wakes up from this idea of being thrown off a conveyor belt, they are stereotyped, they are harassed into thinking that being a gladiator is the only way to physically be well. So how does this look in everyday society? Well, many African American youth, you may have heard them say, therapy is not for Black people. Or if they have been suggested by a loved one for professional help, you will hear that I'm not crazy, I'm not depressed. I'll pray about it. And at the same time, seeking mental health care is often viewed as a weakness or running counter to the survivalist mentality of being born from an oppressive, systematic oppression and chronic racism. So think gladiator again. So much of this pushback against seeking treatment stems from the idea of the lines that we have survived so much adversity. Like, why will we need therapy, or why do we need counseling services now? So we follow this cultural script, and a cultural script refers to the powerful new techniques that articulate cultural norms and values and practices that we teach one another. So example of this is in Christianity, when you go to a funeral, you have a preacher or a priest who talks about the dead as a celebration. Then you have somebody who will come in as a family member who will probably say a few things, or friends. There's an obituary, and then the person is laid to rest. In the Muslim community, when somebody passes, the funeral is the next day. There's not too much long term for grief. So there's a cultural script in which we do as rituals when a situation happens. Similar to in a large society, if a black lady comes into a room screaming and hollering, stereotypically there's a cultural script that says, well, she's an angry black woman. Or if you see a African American male who has tattoos, or he is showing different type of chains and jewelry, the cultural script for society will say, well, this African American male is linked to some type of street life, or they will say he is some type of a thug. And this also intersects with our non-binary folks and also our trans folks. So mental health illness has been compounded by the psychological stress of systematic racism. More than 20% of African American males have reported some type of serious psychological distress more than white males. Due to this, African American males have had a history of why these services and have been prevented from them. So when Black males are outside of this cultural script, sometimes they are not receiving the care that is needed for them. You might see them more in emergency rooms or primary care mental health providers that do not have an association with therapy or counseling. And this is why you don't see Black males in the counseling or therapist facilities. So given these such factors, it's not surprising that African American males are harboring these feelings from families, from friends, from medical providers, and they're reluctant to both the physical and mental health care because of the stress of medical establishments. And this is no new phenomenon either. You may see this in Tuskegee. Think forced sterilization in Black women, childhood vaccinations. There's a long history of mental health frameworks that have oppressed Black people. So the theoretical framework that we're providing today is about the diaspora of literature of what the Black bodies have encompassed and have not have with the self-recognition of what they need to do for healing. Reason being is because they have been overdiagnosed of treatments that people have stereotyped them for. This is no new phenomenon. Since 1960, the protest of psychosis has shown that there's a high rate of Black males being being diagnosed for schizophrenia. And because of these things, we have seen our African American youth being creating a pathway into special education in our educational systems and also into our prison systems due to these misdiagnoses. So today we're going to use a cross-cultural fertilization and critical race approach. in order for us to improve our Black male counseling and also improve how we get interactions with our Black males. And I'm going to have Brandon speak to that.
Thank you. First thing is cultural sensitivity. We have to be able to acknowledge our personal biases, whether those are, we have personal bias towards skin tones, race, gender, names, appearance, language, if someone has English as a second language, or if they speak in a way where they curse or have slang. We have to be able to acknowledge that these things may affect us in our interactions or treatment with said person. Also, as Dr. Webster mentioned, Black men are overdiagnosed for severe mental illness, while being underdiagnosed for mood disorders like depression or anxiety, which can lead to a host of problems. Black men are already reluctant to seek mental health help, as well as visit the doctor in general. So when they do show up and receive an unfavorable diagnosis, they will not return and possibly spread this attitude to their family and communities. So the question is, how do we get them back? We get them back by community involvement and promoting mental health through cross-cultural fertilization with a critical race approach, e.g. visiting barbershops, high schools, community centers, attending games, churches, and other areas Black men congregate. We also need to be aware of fears and cautious attitudes Black men may exhibit. For example, Black men may exhibit fear and caution regarding government agencies and the police. This fear and caution could be seen as paranoia or an irrational fear of taken out of context from the Black experience in America, which could furthermore lead to misdiagnosis and affect the rest of this person's life and their family. And for treatment, we do want to make sure we're active listening and build rapport with the client or the person we're dealing with. You want to reflect what you hear for clarification, use good body language, look them in the eye, show that you're being attentive. You also want to create an environment where they can be their authentic selves. If they curse or use slang, allow them the latitude to do so within reason, of course. If you do not understand something, ask for clarification. It's okay, because they're going to use some terms that you don't know, and I'm pretty sure I might not know them all. This will allow you to build rapport and also let them know that you're genuinely interested in what they have to say. You need to allow the clients to express feelings and emotions, because a lot of times Black men don't have the latitude or the comfortability, rather, to express those emotions. So if they do become emotional, crying or upset, allow it to run its course. They don't get that opportunity. And also, if they do that for you, or not necessarily for you, but with you and in your presence, that shows that they're comfortable. That's the sign of trust as well as vulnerability. So you want to encourage them to continue and allow them the option to stop if needed to. Another treatment modality is narrative therapy or talk therapy. It provides both them and yourself the opportunity to separate them from the problem. It's a technique which relies on a client expressing the problem using storytelling. It also allows them to externalize rather than internalize these damaging beliefs. For example, if a teenager or someone has a test coming up or a big sporting event and they get nervous, they get sweaty palms, their elevated heart rate, they may say, or the parent may say, you're nervous because your anxiety, or your anxiety caused you to fail that test. However, if they're allowed to narrate that experience, they can say, my anxiety made me feel nervous, or my anxiety made my heart rate elevate, which will separate them from the problem and allows you and them to create a plan to eliminate or cope with said problem. This is very important for Black men because it allows their trauma to be seen for what it is and not a reflection of themselves. Next slide. So as far as ongoing treatment, if we have a failure to address Black men's mental health, it risks further inequality and marginalization, as Black men are more likely to be overlooked and underserved in the healthcare system, whether it's mental health or just physical health, which in turn causes Black men to become less likely to seek mental health treatment or medical treatment in general outside of an emergency. Not addressing their mental health needs can lead to poor quality of life, long-term damage to physical and mental well-being, which can and will be passed down to generations after them. If we're unable to meet the mental health needs of Black men, then we also risk the well-being of their families and communities. A lot of what we've learned as youth about emotions and mental health stem from our parents and guardians. Seeking mental health treatment has been taboo for years in the Black community, and it stems from what we have discussed today. If we do not start making Black men feel seen and heard, this cycle will continue. Mr. White.
Okay. Black Boy Heal is a program in partnership with Man-to-Man Counseling, which offers a range of services, including free mental health services from licensed therapists, both virtual and in person, academic success coaching. Black males will be matched with a coach to receive individual assistance with time management skills, goal setting, and study strategies. We also offer wellness plans, a journal that teaches Black males various mental health strategies, including coping, journaling, meditation, and naming that emotion. We're also offering workshops and seminars on a variety of mental health related topics. Our goals and objectives are as follows. We're here to promote mental health awareness and reduce the stigma associated with therapy for Black males. 2, we're here to help improve academic support for Black males in education. 3, we're increasing the access to culturally relevant mental health services, healthcare services. And 4, to train Black youth to be mental health coaches, to recognize and manage mental health issues and educate mental health care providers about prevention and treatment services that work for Black youth. In conjunction with that, we're also working in the space of SUDs. SUDs is substance use disorders within the community that sometimes are not talked about or addressed, and they just are a continuation of either a mental health issue or the complete opposite, where you're self-medicating and then you develop psychosis due to the self-medication. It's been proven that over 258,000 individuals over the age of 12 have been classified as you having a substance use disorder just in the past year. And then you look and you find out that it affects the school work, because those who abuse drugs have lower grades, a higher rate of absence from school and other activities, and an increased potential for dropping out of school. Substance abusing youth usually are at a higher risk than non-users for mental health problems, including depression, conduct problems, personality disorders, suicidal thoughts, attempted suicide, and suicide. Our objective is to also educate and make aware. That's just a start. We also have evidence-based curriculums that are solution-focused to help mitigate some of these issues. And even though there's no cure for addiction, there's treatment through counseling, coaching, and aftercare support through a number of medical treatment facilities throughout the nation that we have aligned and partnered ourselves with. How much time do we have, Conrad?
We still got time. We got 20 minutes.
Okay, so I could go a little deeper into this. So how Black Boy Heal helps not only America's school system, but the communities at large by addressing these rising drug problems is that you think about it, there's over 35% of 12th graders across the US that have reported vaping in the past year. There have been over 37% of those same 12th graders that have reported smoking marijuana in the past year, which we know is a gateway. The things that are happening now, not only in your city, but in every city across the United States, is that fentanyl is becoming a major player in the drug game. First, it was opioids, and now you have something that's more powerful than the opioids. With the opioid epidemic, there was 109% increase of overdoses in adolescents in the last year. So what we bring to the table with Black Boy Heal is a classroom-based prevention program that aims to reduce substance use among adolescents and those in the community, a school-based program that prevents or delay illicit drug use among students. Teachers will receive the training on the Black Boy Heal curriculum. It encompasses the following skill sets: social competence, social influence, self-management, drug awareness, drug refusal. Black Boy Heal has proven effective in addressing substance use when combined with other interventions. Now, our overall objective is to create a multifaceted approach involving school districts, parents, and communities to help destigmatize the need for help with the teamwork in place and parental involvement is key. Teachers and school staff will also play a vital role in fighting this issue alongside with Black Boy Heal. So partnering with Black Boy Heal to incorporate life skill training programs into school curricula that focuses on enhancing problem solving, decision making, and coping skills. The action plan that's in place will go to support and allocate resources to treatment programs and medical facilities around the nation. Those services are for adolescents struggling with substance abuse, as well as mental health issues, ensuring early intervention and access to appropriate care. Should we go any further?
That is our that is our presentation. If you have any questions, please ask on for all the participants who are watching. I think we have something in the chat.
There was a question in the chat. Specifically, it was from, let's see here, where'd we go? There was questions. There's a lot of interest in having the slides sent out. So I think that's a wonderful sign. Did you see where the question went, actually, Vanessa?
I just saw a full introduction.
Do it for individual students if you have like 30, or if you have a school district who wants our support as a whole to work with your elementary, your middle schools, and high schools. We have also an intake form for that. And all the service that comes with is personalized training for your teachers and your administrative staff. We also have our wellness book that provides a mental health capacity building, and then the free mental health services.
And also, along with the school districts, we also provide the Wellness Recovery Action Planning. It's called WRAP. But the Wellness Recovery Action Planning can be not only be utilized for students, but for staff as well. Because we all know that school districts, a lot of staff and teachers are feeling overwhelmed, underpaid, underappreciated, and they get stressed out as well. So we have action plans in place for them as well.
I think those are incredible tools that can be widely utilized in our communities. Thank you. I think we have time for another question, and I see, how do we get non-Black individuals not to see Black males' emotion as rage and become scared, but that they need actual mental emotional support? This automatically counts them out for any kind of mental support, making it hard for us to heal.
I'm sorry, I was
Was that a question?
How do we get
Yes.
non-Black folks to not see male emotion and Black male emotion? So that the beginning part was the question.
Part of that goes to what
Education
I
and
spoke on.
awareness.
I was going to say part of that is on what I spoke on about checking your biases. But that's tricky because you have to want to change or view someone as, a human and not rage and the things you've already been internalized or interpreting them as. So for us, it would start if we were to work with your district or a district and things we would work with the teachers on. But just in general, people have to check their biases and approach people as people first.
Also with that, Brandon, the trauma-informed care aspect comes into play, because in trauma-informed care, you're trying to get to the root of why. You see someone acting out, but you just see that. When do you get to the question of asking, why are they acting like that? What are they in need of? Are they in need of help? Or are they in need of someone to just pull them to the side and ask them how their day is going? Sometimes we're as Black men, we're taught to not only suppress our emotions, we're taught to repress our emotions as well. And that's to our detriment. That's why most men just clam up and then self-medicate, whether it's through smoking, drinking, or some unhealthy activities.
all right. Can I add something real quick? It's not off topic, but it's on topic, but it's off topic. So just to let a lot of folks know that a lot of folks know that's in this space. So we work in 2 states. We work in the state of Washington and we work in Texas. Currently, we have more of our resources in Texas that we're trying to bring up to the state of Washington and build out this mental health wellness and programming that we have. We would love to work with your school districts in any capacity that you see fit. We also would love to work with your youth, but know that as we're building this out, there's going to be some hiccups that come in between. So we're trying to be a great service. We're not a perfect service, but the more that you invest into these type of programs, the more you invest into this type of action plan, the better that we become. So please lean on to us for our services. Yes, we would like to partner with the Boys and Girls Club and any other partnerships that is meaningful in these communities. And yes, we also are bringing a woman's side to this in fall of 2024. We're just trying to build up our resources for that. We don't want to roll out something that we don't have enough resources for and create a negative impact. That's not what we want to do. So please provide us some time for that.
Thank you. I see not a question, but thank you so much for this. And I would love to just second that. We are going to move on and we are going to highlight another organization in our community, but I just want to say thank you so much, Dr. Webster, Brandon, and Chris for being here, for participating in this conversation, and just know that this isn't the end of these conversations. We can continue to have further conversations to support further webinars through Kids Mental Health Pierce County. I see so many reactions, heart emojis, and clapping hands, and know that this was received so well from our community and it's so needed. Appreciate you being here and would love to continue these conversations moving forward. I have added the website in the chat, and we will look to share additional information through our website as well as to our email contact. So thank you very much for being here. I appreciate you all and the work you're doing.
Thanks for having us.
Thanks for having us.
And with that, we are going to move on to a resource highlight right here. I would love to just introduce my friend, Brian Gatewood Sr. from Innovative Changemakers.
Hello, hello. So good afternoon, everybody. My name is Brian Gatewood. I'm with Innovative Changemakers, and Innovative Changemakers is structured as a youth empowerment program or organization, but we want us to be intentional about working with parents as well, because what better way to empower youth than empowering parents as well, you know? And so one of the things that we decided to do is have it started out as a fatherhood group, but we named it Iron Sharpens Iron, which is from the Proverbs 27:17, as iron sharpens iron, one man sharpens the next. And so in our program, we wanted to create a safe space for men to gather and unpack various, the weights of life and be able to just get all that stuff and unpack in a safe space, which we as men don't get a lot of, And so we were intentional about specifically structuring our group around fatherhood, but then our first meeting, we ended up having multiple people who weren't fathers who end up showing up, and we wanted to create that space for them as well and open our doors for men who aren't fathers. And so we took the fatherhood off and just had it be our men's group, our Iron Sharpens Iron men's group. And so, as we know, there's no roadmap to life, there's no playbook. And so, thing that we can do is utilize the experiences of others to, help navigate. And so this group has been super, good for myself and, the community that's came out. We get a lot out of it. And we meet once a month in person at Tacoma Urban League. And then we also meet once a month via Zoom. And I have a co-facilitator on here as well, Ade Priester, who wanted to jump on and say a few words as well.
Hello. Can I be heard?
Yes, we can hear you.
Okay. So, yeah, my name is, I guess it's not on the video, but as Brian said, my name is Ade Priester. I'm a program director with Innovative Changemakers. and I'm also a regular participant with the Iron Sharpens Iron men's group, and we are focused on trying to create a congregation of fathers and men who can get together, just kind of like with the gentleman with the group, Black Boy Hill, the Black Boy Hill group. They were saying where men congregate. We want to create a place where men can congregate and talk about the issues that concern fathers and concern men in the community. When we are welcoming new members to our social media group, we kind of give a little rundown. I say, unlike most Facebook groups, this is an online space that can translate into real life action, activities, networking, support services, interaction with real individuals, help with problems, and an overall respect for the challenges of fatherhood. We ask that you tell a friend and bring a friend. We conduct live sessions and fatherhood activities to benefit our community. When there are real people doing real things, confronting real consequences, we want to present real solutions. So salute to all the fathers, salute to all our children. And we are kind of kicking off with the building this congregation, building this community of Iron Sharpens Iron by just creating a atmosphere where people can come together and interact with others with a similar background, and also kind of have a bonding stage with the facilitators and the group, as well as an awareness of the potential resources available to help with fatherhood issues. So the goal is to translate all the discussions, the social interactions, and bonding activities into an awareness of what resources are needed and providing access to those resources. And also we want to have an educational component on subjects like financial literacy and interpersonal relationships in order to strengthen the role of fatherhood and empowerment to the community.
Thank you, Brian. Thank you, Jay.
Yeah, appreciate you. Thank you guys for allowing us to come into your space and, talk about our program.
Yeah, I would like to add that, Brian, you're doing incredible work in other spaces. And if there are any other programs that you think are important to highlight here, you're able to do so as well.
Most definitely. So we, as an organization, as I said, is a youth empowerment organization, and we felt, how to best empower the youth is to give them opportunity. And so we have 6 active programs. And so I can just talk about a couple of them that stand out to me currently that are active and can be enrolled in. So one of them is our feature photography program, which we end up partnering with. Our facilitator's name is Paul Sanders, and he's, a local photographer who does a whole lot, in community. And so what he does is he teaches, set design. He teaches, the ins and outs of how to operate a camera. He teaches how to video. He teaches how to edit those videos. And then there's an entrepreneurship piece, which teaches how to take the skills that you've learned in those classes and, put them in the everyday and real life scenarios. And so we partner with a couple other local organizations, which after completion of the program, these kids will be hired on as videographers, and then they're able to keep their cameras, they're able to keep the computers that we got for them. And so they will in turn be their own entrepreneurs at the end of these programs. And so that's one that's currently in, and there's the QR code on the flyer that you can currently enroll your students in. And that's a good one. If you scroll past it. Then we have like our fitness and nutrition. And so that's a program. And like that one, we have both youth and adults. And so this one that's on there currently, that's from an old event. But what we do is we host boot camps. And so we keep them separate. So like there's boot camps that'll be focused towards youth that'll, be a lot more active and, games, just like on this flyer right here, we had it at Defy. And so like we had a bunch of different games within Defy, and kids were able to just get out of the house and put those electronics down and bounce around for, a couple hours and learn about different, different muscle groups and how they can focus those on those different muscle groups. And then we have like our boot camps and bubblies, which are focused more towards adult women, which, it's a safe space for women to work out together. And then the facilitator will modify workouts if you have any, ailments or anything like that, or any movements that you can't do, the workouts will be modified. And of course, the bubbly aspect is is what it is. And so, that's a good one. And that's also one that can be registered for right now. And then I liked the fact that Black Boy Hill had a barbershop program, because we also have a barbershop program. It's called Innovative Cuts. And so what we do with Innovative Cuts is we teach the barbering aspect, the component of that. We have local barbers teaching that portion. And then we put mental health first aid into the barbershop program, because of course there is a stigma around mental health in the Black community. But as they stated, barbers are some of our first therapists. We're able to open up to them and talk, and that is our safe space. And so we wanted to take that same feeling and put it towards youth, and have youth be that driving force, and have them be like those first responders and those peer advocates. And so that's one of the programs that we have as well. And we're partnering with the YMCA to get that started, because they have their own standing like barbering facility out in Federal Way. And so we're able to utilize that facility. And yeah, those are currently some of the things that we're doing as we speak. And then we have a active summer program that we're actually launching the flyer for today. And it's based around just getting kids back out in nature. We're taking them outside and doing all kinds of things. We're horseback riding, going on canoes, overnight camping trips, like, because all those things have those mental health components as well, and just like I try to focus our activities on putting the electronics down and getting outside and actually being one in nature, is that like for me, that's how I decompress. And so we're trying to, get kids out and do all kind of stuff this summer. And so that we are dropping that flyer this afternoon, pretty much, I think as soon as we get off this call, and I can send you that flyer as well, so people can register the youth for that. And then the ages for that one is 10 through 17.
That's incredible, Brian. Yes, please send that flyer my way. And I will be sharing all of these events, all of the Innovative Changemakers events on kidsmentalhealthpiercecounty.org. On the website, we are really looking at utilizing the community calendar on that page. So if you have events or information that you'd like to share, please go to kidsmentalhealthpiercecounty.org, and you can submit information to me, to myself, or one of my colleagues directly, and we will be highlighting all of the incredible things the Innovative Changemakers are doing in our community, all the events. They have late night climb coming up this weekend. We've gone fishing with them. I've joined them fishing. I've joined them outside, and just the ways that they're interacting in the community in different spaces in innovative ways is really incredible. And I'm so grateful for the work y'all are doing. Again, I appreciate all of you for being here, all of you for sharing your organizations and your information, and just such incredible work that you're doing. Would love to continue to highlight the work you're doing, partner with our community. Pierce County is so lucky to have such incredible folks. Again, we are Kids Mental Health Pierce County, a community coalition of agencies and providers looking at supporting young folks, getting support through behavioral health services and needs met in different ways. And what that looks like is very different for different communities. So thank you all for being here. We will look forward to seeing you all soon. If you have information, ideas, or anything, please send it to our website and we will post it there. Again, thank you all for attending.
Thank you all. Thank you all.
Thank you. We appreciate it.
Thank you, Vanessa.
Thank you. It was great listening.